this is Dr. Ben Barton in Columbia, South Carolina. And for the last 5 years, we've been doing what's called spinal decompression therapy here at our clinic. That therapy is really meant for patients who have been diagnosed with a disc herniation, degenerative disc disease, sciatica, or spinal stenosis. So what we're going to talk about first is what actually is a disc herniation and how do you actually hurt your lower back. There's a million different reasons why your back can bother you. However, disc herniations are a very serious problem, whether it be in your neck or being in your lower back. And typically what happens with patients with disc lesions is they will have chronic pain off and on for several years. It's kind of an insidious thing that starts to catch up with a patient where they'll say, yeah, my back, it hurt 10 years ago, then it quit hurting, then 5 years ago it hurt, and then a year ago it started hurting. And what we see is every time that their back goes out on them, it actually gets a little bit worse. The time by which the pain actually, the time by which they're actually in pain actually increases, and also the severity of the pain actually increases. What we also see though is some patients who will just say, hey, listen, I just bent over to tie my shoe, my back went out on me, I couldn't stand up for an hour. And so either way, what typically happens is you have a disc problem. And so I'm going to use this model to show you exactly what that means. So this model, it shows the bones of your back, and then it shows in between the vertebrae, we actually have what's called a disc. And it's kind of like a peanut butter and jelly material, but it's actually harder than that. But it's got two parts to it. And the first part is actually some cartilage, and the inner part is actually some fluid, which is actually mostly water. And then this is the spinal cord, and these are the nerves. So what happens a lot of times with the patients who say, yeah, my back's been bugging me off and on for 10 years or 5 years or whatever the case may be, is the disc is actually shrinking. It's actually dehydrating on them. And whenever it starts to dehydrate, that means it's actually becoming more brittle. It's actually becoming harder. And so what will happen is it'll actually break, and it'll either hit the spinal cord itself, or it will hit one of the nerve roots. So if this disc starts to shrink and wear out on you, and it herniates, then what it'll do, if it's bulging, it'll just swell up. It's just inflamed. And it'll hit the spinal cord, it'll hit the nerves. And if it herniates, this fluid actually will come out and start pressing up against the cord. So, you could have a disc herniation, and it can go in several different directions, but typically you'll say, okay, it either hurts down the leg or down the right leg, left leg, or it'll just be real chronic back pain. And the one thing about that too is that patients will typically say, well, it's really, really painful when I get up out of bed. It takes me an hour to loosen up. It'll hurt when they cough or sneeze, or when they're driving, if they hit a bump, it'll grab their back or their neck. That's what we typically see with somebody with a disc herniation. A lot of times they'll have that as some of their symptoms. And so the other thing that can happen is the disc can actually break. It'll actually break off, and it'll be a free fragment, or be called sequestered disc. So if you have an MRI that says I have a sequestered disc, well, that's really, unfortunately, you're in a position where you have to have surgery for that. That's the only real way to fix that. So the other thing that we see a lot of times with patients when they have back issues is they'll say, well, I've tried conservative things like physical therapy, I've tried epidurals. The biggest thing that we see is patients will say, I've been trying pain pills, I've been trying drugs, either steroids, pain pills, narcotics, even 800 milligram Motrin, whatever. And so the problem with that is when you have a disc issue, when this is broken, you have an issue where you have something that's a physical problem, something is broken in your back, just like a dislocated shoulder. There's a couple different types of problems you can have in your body, and if you have something that's a physical problem and you try to treat it with drugs, that's apples and oranges. It's not going to work. It's not the same thing. And the way to equate that is if you're driving down the street with your car and your check engine light comes on, that's kind of like that's your body's way of pain. It's telling you pain is a symptom. It's a signal that something's wrong. So it's kind of like if you're taking the pain pills, it's sticking your thumb over that check engine light, and you keep on driving down the street. Sooner or later, your back is going to break down on you, just like a car will. So what we do is spinal decompression therapy. The easy way to describe it is it's a super form of traction, I guess is the easiest way of saying it. It's very different from traction because traction is just pulling you straight across, and it's just trying to either stretch out your neck or it stretches out your lower back. The difference is decompression therapy we can angle the machine so that it actually hits that one area in a much better way. It can actually pull your body apart, stretch that area out much better, and then also we can pull you much harder because the machine is actually monitoring what your body's doing, and it's seeing if you go into spasm and traction, the machine doesn't change. And so that's the difference. It's much more comfortable, and we've had tons of patients, at least 100 patients, who've said, I've tried traction, it didn't work. Decompression therapy was, number one, much more comfortable, number two, they had much better results from it. So what we want to offer for you guys as patients, if you're a potential candidate, we would have to do a consultation. We'd have to evaluate whether or not you had an MRI showing that you had a disc herniation, or we need to do an exam and maybe get an MRI scheduled for you. But what we're going to offer is a free consultation to come in and talk to me to see whether or not you may potentially be a good candidate for decompression therapy, or if you've been told that you need surgery, and if you've already tried other forms of therapy that haven't worked, you'd be a good candidate for decompression. So if you want to come in and make a consultation, you can do it one of two ways. You can either call us at 803-419-2140, or you can go down, you can scroll down the web page, and there's actually an online form you can fill out, and we'll contact you within 24 hours to determine whether or not we can get you in to have a free consultation with me. The other thing in closing is, if you are a good candidate, the first visit is on us. So if we go through everything, we determine that you're going to be a good candidate for the therapy, then the first visit will be on the house. We'll take care of that for you. And what you need to do is call as soon as possible to get scheduled, because we're very limited in the time that we have as far as the consultations go. And so we would need to get you scheduled as soon as possible to determine whether or not you're a good candidate for our therapy. Thank you and have a great day.